Okay, so to do it, I'm going to demonstrate a Shiatsu treatment on Tamsin. Hello Tamsin, and thank you for being on model today.
Hi.
Hi. So just to ground us, because it is a very grounding therapy, we can start off by doing a 4-part breathing. So basically we're just breathing in for 4, holding for 4, breathing out for 4, and then and we can do it 4 times. That probably makes sense, doesn't it? You don't have to remember any other numbers. So for you and me, we'll just make a start. If we do it in unison, it'll be quite good, because then I can just start, and I will talk through what I'm doing as well. So breathing in for 4. Have you done your 4?
Yes.
Okay. So in a Shiatsu treatment, because we're talking about, I'm not going to go into any detail or anything, but we talk about the 5-element theory, Chinese theory, and we also talk about meridians and lines and points which relate to different organs in the body. So I'm not really going to go into any more detail than that, but just so that I know what Tamsin comes up for her is my guidelines to know how to work with her, basically. So this area here, her abdomen, will have all the, which is called the hara, and the organs are all in this space. So what I do is I'll just be palpating, and this is actually a treatment in itself. And some say that it's more accurate than pulse diagnosis, which is pretty impressive. So it's just a gentle holding. So I'm getting the feel of her breathing. So when we talk about what we're feeling for, we're talking about hard and soft, and these sort of Chinese, Japanese words for those would be Kyo and Jitsu. So Kyo is basically a very soft area. You work differently in Jitsu is more needing to disperse, and areas would be working a lot quicker. So in the body, because all our bodies, they're not always so finely tuned that they're working perfectly 100% okay. So you're always going to find little bits of imbalances. And all this is doing is balancing your body in a better way. So we're just going in at the top here, and then it's nice to get some feedback as well about the pressure. The pressure okay? Yeah. You can see here I can go a little more. This is your stomach, your belly button, yeah?
Yeah.
Please. So with this, I'm just going to show some of the techniques or the different things I'm going to use to work on her. Like this is just using finger pressure, for example. You get a feel of what you can use. You can use like the heel of the hand. And slowly, and you can still pick up the sensitivities. And then when you come to like the middle of the here, there's another. So this is the hara basically. This is working the hara to get a diagnosis of what you're going to work on. But because I have said that I'm not going to work on any specific meridians at this point, when I am working, it's just to give you an idea as to stretches and different ways that I use my body to work with you. So to loosen up the body, and comes in this nicely relaxed, which is always great. Just a little rocking motion is nice, it's relaxing. So if there is anything that doesn't feel right, then you just need to speak out. So we just get a feel. what's going on. So again, using the palm of my hand, and use the palm just so the body gets used to what it's been received. Now there is a connection between the hands. So I've got this hand, which they call the mother hand, and this hand, which is, I suppose it's like the working hand really. It's the one that's doing the motions. And if you notice, I'm using my leg here to support the pressure. So that was using the palm of my hand, and then you can say, is the pressure okay? And then again, it'll be a different pressure if I go in with my thumbs. So when I go in with my thumbs, I can get more of a reaction in my mother hand. And a lot of this is actually working with intuition. So, the energy moves. So it's not going to stick rigidly to lines in the body or points or anything like that. So you kind of have to be intuitive to that. And just go where it flows. So to loosen up, we can do a lot of rocking on the feet. And at this point, I would move around and actually do some stretches. Just pick up the leg. And so using my leg against her leg like this, feels okay? Yeah. So then I would be doing gentle stretches. Obviously people have different flexibilities. Tamsin's pretty flexible. And you can give slight hip rotations. You can actually pull the foot up and then stretch, getting that stretch. And if I put her leg down, just to show you that this is the leg that's just been, not even for very long, I've been working on, compared to this one, which I don't know if it really picks up. It's not, because she's quite relaxed anyway, there's not a big difference. But sometimes when you work on someone, you can see like one area's been worked and the other hasn't, and there's a big difference. But I think because Tamsin is very relaxed, there's not a big difference between this leg and that leg, for example. So with the working, it goes very much on the breathing as well, so that can always help you. And I always say to my clients that if there's an area where I say I go in, and it's the Kyo area, which is soft and it's uncomfortable, then just to really breathe into it, because that will help. So if Tamsin has any areas that feel uncomfortable for her, then that will help her. Or if it's too much, then obviously she'll speak out. So again, using the palms, or using the thumb. And coming around again with the stretches, you can just pick up the ankles like this and just stretch. You feel that stretch? And then what you remember to do on one side, do on the other side as well. So pick up the leg. Do the rotations. shaking, rocking. All these things are quite nice to relax the client. So I was working sort of like along these lines here, but I could take a different position. I could actually, like using my foot, just work along here. See, this for me, I'm feeling the jitsu. So I would work a lot quicker. You see, that feels a lot more uncomfortable, doesn't it? A little. So just working a bit quicker just to disperse some of that tightness in the leg. Okay, so I did that side, so I'll move on to here. And do this side. Okay, so I'm using her leg there just to expose this part of her leg which was tighter. Now, different sides of the body can really differ. So here, for example, I'm feeling under my hand is a lot not so tight, so it can change. Bodies are very complex things. Okay, so this is like how you might want to work with the legs. Now, so we've covered the hara, we've covered the legs. So I'm just going to go over here to the back and ask if Tamsin's in a comfortable position with your head. Yeah. Okay, so I'm going to be working on the shoulders. And this is like, you know, what cats do when they're padding down, you know. How is that pressure? Fine. It's not too strong. So. Because with Shiatsu we use what we call perpendicular pressure, which is basically I can come forward and I'm actually using my body weight on Tamsin. Now Tamsin's quite slight, so you have to be quite mindful about how much pressure people can take. So I'm using my body for the weight, but I'm also using my breath. And this is another really nice area to work on the neck. So I can tilt her head and give her nice, soft, gentle calming. So a lot of our tension is in our neck. So this big muscle here, your sternocleidomastoid, will be an area where there's a lot of tightness. You feel any tightness in there?
I do often.
Yeah. You're quite chill today, aren't you?
Yeah.
I can tell. It's just a bit of stroking with my fingers, but the pressure is quite heavy. It's always got to be a little bit heavy because she's got to feel it. So if it's too heavy, she'll let me know. You can move that around and just then do this side. And here you can work on the chest area as well, so you have to be mindful of like where you're pressing, for example. So again, we're talking about the hara area here, so we can go across the sternum. Now there is an area, and it is a meridian as well, which runs across the chest. So now this, for women, is actually quite uncomfortable. So if you get a few ouchy places, then that's quite normal. Can you feel those points? Good. You've been really good today.
So here you can work with the side of your hand. And here, this is very fleshy obviously, it's going to feel soft, but there's an area again where you can store a lot of discomfort. So really the body's just saying like, no, I'm here, you know, whatever you're feeling. And then you have to sometimes just hold it there long enough to let that go, let it go. So breathing into it, or so again, I don't know if we talked about intuition, but working with your intuition on something like this. You know, how long, how much. It's very much up to what you find when you're doing the work. So from this point here, you can do some stretches on the arms. You can just bend the arm and you can do some rotations on the wrist and the elbows. Remember, the meridians come right to the ends. So just clicky there. So, what we want to do now is we just want to pull the shoulder, give her a nice stretch. So I'm sitting on my hunches here and I'm holding hers quite tightly here, but hopefully not too tightly that it's uncomfortable, but she feels supported. And then I will just stretch. And then just release that. That's one stretch. You can do another stretch. And you're kind of here, you're doing the stretch. It's just a lot more effective if you actually do it with the breathing. So you might feel like it's, oh wow, that looks really strong, but it's actually not too bad, is it? It feels nice. It feels nice. Okay, so again, I normally, after I've done a stretch or I've worked on anything, any part of the body, I just like to see that it's sort of softened up a little bit. Okay, very good. Other side. Nice and warm today. So coming to the ends of the fingers, the ends of meridian lines, all around the wrist areas, using fingers and thumbs, elbows, okay, onto the shoulder, again using your leg to support and pull. It feels quite dynamic really, isn't it? And you can even actually go this way. And this way. And then what we did is we did it this way, didn't we? So it does help to use different parts of you to get a more effective shiatsu treatment. Right, okay, so now Tamsin is quite relaxed, hopefully. Just ask her to turn around and lie on her front. But get into a comfortable position. If you need extra props to get there. So we talked about the hara being on the front side, but there's also the areas on the back, the hara on the back. So you can actually work on the areas of the back as well as the diagnosis of the horror one you find in the front, for example. So the backs are often can be quite stiff. So again, probably the most effective way to work on a back, I feel, is to just check that Tamsin's in a comfortable position for herself.
Am I on?
Yeah, I'll move you, okay? All right. So what you don't do when they're on their front is you never work the spine, not in any treatment that I've ever come across anyway. So you work around the spine. So what you do is you just press, but again, using your breath and using your body. Is that pressure okay? Yeah?
Fine.
So here I'm picking up a sort of stiff area, and I'm just going to because there's a lot of heat. You're probably feeling the heat from my hands. So a lot of that is the heat from my hands is actually relaxing the muscles as well as the pressure. So I'm not working the spine, but I'm working around it. So this is always a good one, especially for Tamsin to get used to what it is I'm doing. But you can do all sorts of things really. So you can, the area around the scapula is always an area where we hold a lot of tightness and pressure. So what I'm going to do is I'm just going to take Tamsin's hand and I'm just going to put it around her back. Snuggle up with her here, okay? I'm going to work this area here. Now, for me to get very sort of into the spots, I like to use heavy pressure. So if it's too much, please speak out. I'm just literally working around the scapula with my elbow. And this isn't hurting you, is it?
No.
It's a comfortable position, isn't it? So it's working there, and you can do the same with this area here, the lower back, because it's like it's being rocked. You can get into some really nice positions where you can just stay and hold the pressure on the back. Breathe into it. So these areas around the sacrum can also be really quite tight. Yeah? Feeling that? Yeah? So using the elbow just to loosen up. So some rocking. Some heavy pressure. And so you can use, you can keep going over the same points as well, because what you find is what starts off being like ouch, can actually, once you've done a little bit of hampering or something to that spot, then it kind of realises it's meant to let go, and it let goes, and then you feel a whole lot better. So you can do the whole of the sacrum area using this. And it's always a good idea to do lots of rocking movements, because the body really likes the rocking. Something about like when you're a baby and you're crying and then your mum's rocking you. It's like really very, very comforting about that. So I would say Tamsin's is a really good place at the moment. She's nicely relaxed, and I think it's easier to relax actually when you're on your front, because you probably feel like there's nothing, you don't have to do it. Well, she didn't the other way, but this is at least a lot easier to let go. So again, I'm just showing you working with the palms. All the way down the leg. She's so nicely relaxed, look, little wobbly. If I found this is quite enough pressure for her, but if it was very jitsu, very tight, you can go in with your knees and all sorts of things. I can give you a little demonstration, but I'm not going to hurt her because she's a bit relaxed. So, but just to give you an example of how that would look, what you do is you just, that's not too much.
No, it's fine.
You go in, and that is quite strong. That is very strong, actually. And some people like it. So again, this rocking, pressure, and then you can incorporate stretches. So get behind the legs. Always in Shiatsu, the nicest thing is that you feel supported, so that's nice. You never feel like abandoned. Are you feeling the stretch in the front? Yeah. So again, I'm using my breath. You can turn the legs around this way. And then holding the ankles, do a bit more rocking. And then, this again is quite strong, so I'm going to just try it, but if it's too much, just say. Okay, so I'm using my knees on her feet. Is that too strong?
No, it's fine.
Okay. That's quite a lot of my weight just on her feet like this. So it's always a good idea to get feet back, because some people could just go through the roof with it. So as I'm doing this, I can feel a lot of sensation through my hands. But because it's a strong stretch, you wouldn't actually stay there that long, so just stay. Stay with that. So what I'm going to do is, we did this up, the scapula on this side, so we need to do the same again on this side. So I'm going to just and ask her to move her arms this way. We'll support with my leg, I think, the easy way. I'll keep that into position, and then just using my thumbs to work around the spine. Remember always to leave the spine, but work around the scapula. Use the side of your hand. So do a little bit around the shoulder, and I'll probably come from the top area here If you really wanted to, you could go in heavier actually with the elbows and stuff, because areas which has got a lot of tension kind of need that stronger work. Now Tamsin seems very relaxed, so I'm not going to do an awful lot more now. Just literally just sit and hold. It's like a consolidation of work that's been done. So, thank you, Tamsin. Just in your own time, just and we encourage, obviously, drinking a lot of water afterwards. I don't know if I mentioned at the beginning the questionnaire, filling in forms and finding out about the client's health a bit before you actually do the work, so that's as important as anything really. So is there any sort of feedback you'd like to share, Tamsin, after receiving?
I feel very relaxed, thank you.
Okay.
And the pressure was fine. It didn't feel too much at any point.
Okay.
Thank you.
Thank you.